Now, the American Diabetes Association says there are 29 million diabetics right here in the U.S., and about 1 million are insulin dependent with type 1. Diabetes is a meal-by-meal disease, which can, of course, be very challenging. Without proper care, diabetes can lead to major health complications, including death. Today is the last day of Diabetes Awareness Month.
And KTVU's Kiba Arnold spoke with Dr. Jean-Louis Silam, who practices at the Diabetes Research Center in Los Angeles, about the impact of diabetes in America.
Dr. Silam, as we wrap up Diabetes Awareness Month, I wanted to talk about the impact diabetes has right here on our country. It certainly changes lives. I was diagnosed type 1 just a little over a year ago. My older brother diagnosed type 1. That was 27 years ago. And doctor, back then, we thought there would be a cure by now.
Well, there will be a cure sometime, someday, but that's not for tomorrow. I'm sorry to disappoint you. Type 1 is on the rise, and type 2 is epidemic in the U.S. Type 2, about 10% of the U.S. population now, doubling every 5 to 10 years. Like in 2010, you were like 20 millions, and now you are 30 millions.
Tell us about the Diabetes Research Center there in Los Angeles, where you're currently at, some of the advancements, the research that you've done.
We are a dedicated, independent research center where we perform FDA-approved clinical trial on diabetes, testing devices and new drugs, new insulins.
How important is your research and raising money for research, and also how important are clinical studies?
I think the FDA could not approve any drug without us. Usually they have to have like several dozens, if not several hundreds of sites in the US before they can approve it. It takes years and thousands of patients. So we have like now currently doing maybe 10 to 20 studies at a time on hundreds of volunteers. And that's critical.
Dr. Silam says the insulin treatments are improving, including methods for longer lasting treatments so diabetes patients don't have to deal with injections multiple times a day.
Yeah, there's also a promising new treatment of inhalable insulin. It's called Afrezza, that has a lot of people talking right now.
And some say the product offers an easier, more convenient way to receive insulin, but some doctors say more research is needed to determine just how effective the rapid-fire inhaler actually is versus more traditional injections and catheters.
Well, always interesting to get a perspective on diabetes,
exactly.
especially as we wrap up the Awareness Month.